We treated our first patient at OneWelbeck in 2019, and we offer anything from outpatient consultation through diagnostics, MRI, CT scanning, endoscopy, right through to day surgery. We spent a lot of time in the early days looking at the available systems and thinking about what would fit best for us over the following 5 to 10 years. Compucare has been able to support us from when we were very small and treating very small numbers of patients right up to now where we're pretty high volume. We're probably within the 5 largest providers in central London, and Compucare has been able to support us throughout that scaling.
Compucare has a lot of information which is very important for both our patients and doctors. Each profile is there for the doctors to track their whole process, for all their results, all their bookings, and also for us as a team to track all correspondence and to keep on top of the patient's journey and ensure that all their tests are all up to date. Bloods in itself sees over about 3,000 to 4,000 orders a week. The lab would send over PDF results to us in our inbox. Those then had to be downloaded and attached to each patient's profile. With Compucare and us working closely with IT, we were able to streamline that process by having digital EDIs both out and back into Compucare. Prior to that, an upload would normally take 24 to 48 hours, waiting for the PDF to come in, convert, upload. With making it fully streamlined, results were coming in 4 to 5 hours.
It has a different way of putting the platform for different teams. So I know that surgical centre will have a different view for their scheduler, whereas we would then have a different view of like the way the patient list is formed. For my day-to-day, it's like I know where things are accessible. I can put what filters I need on the outpatient bookings and for the different sections.
Every patient, no matter what they come into Welbeck for, will have a patient record where all appointments, all billing episodes, all results, all stored and managed in Compucare.
Other process that we've then adapted using Compucare is digitalised consent forms. By putting these processes in place, it allows our team to spend more time with the actual patients and doing the care bit which we want them to be doing, and allows us to then deliver the first class high-level service that we need to do for our patients.
Because it was such a big improvement for patient experience and efficiency, when we launched it, it worked so beautifully. We just saw the adoption of the new functionality go up to 70% within a couple of weeks, and everybody involved loved it.
I came into OneWelbeck because I was struggling to breathe. I could feel my lungs getting quite constricted. I ended up seeing one of the consultants who then referred me to do a couple of lung tests to see if they can diagnose what the problem is. They were able to work around my busy schedule to fit me in. When I get the text and I had to fill out the needed details for my appointment, I could again do that at my own time. After the test, he said to me that I would receive my results, which would be reported by the doctor within 24 hours. And to be honest, it was about 3 or 4 hours after I left for my appointment that I got my results, which was great because it exceeded my expectations. Being able to be in control of your own healthcare and your own timetable and everything was essential for me. And you can see that it's something that OneWelbeck has put a lot of thought into, is making a patient's journey as seamless as possible, and the systems they've got in place really allows for the patients to have a good experience and focus on their health rather than focusing on all kind of administrative work that goes along with booking these appointments.
We've been able to talk with someone that really understood our needs and that was willing to help to make sure that whatever is built in the system is actually solving a customer problem. We actually have a very tight business continuity plan that it relies on regular reports coming from Compucare, because without it, our clinics stop.
So working with Streets Heaver has been great. We feel like a real partner to them. Working with Andy and the team, they really understand our business. They understand what our priorities are, and they listen to what we're trying to achieve. It does feel like a real partnership. We're trying to improve the way our business works, and Andy and the team are trying to improve how the product works. And where we can find things that do both, we get them done really quickly, which is fantastic.